Dr. Bernstein's diabetes solution. What if everything you have been told about managing diabetes was not just wrong, but dangerously wrong? What if the very diet recommended by diabetes associations was actually making your condition worse? Today, we are diving into Dr. Bernstein's Diabetes Solution, a book that turned the diabetes world upside down and has helped thousands achieve what doctors said was impossible: normal blood sugar levels. The rebel who changed everything. Dr. Richard Bernstein was not supposed to revolutionize diabetes care. He was an engineer who happened to have type 1 diabetes. For 12 years, he followed conventional medical advice and watched his health deteriorate. Complications were piling up. His future looked grim. Then something extraordinary happened. In 1969, he got his hands on a blood glucose meter, technology that was only available to hospitals at the time. What he discovered by testing his blood sugar throughout the day shocked him. The standard diabetes recommendations were causing dangerous blood sugar swings that no one was measuring. This engineer decided to approach his diabetes like an engineering problem. He started experimenting, measuring, and tracking everything. What he discovered became a medical revolution that challenged decades of established practice: the fatal flaw in standard diabetes care. Here is the problem with traditional diabetes management. The American Diabetes Association recommends that tight control of blood sugars is achieved with levels between 90 to 130 milligrams before meals and less than 180 milligrams 2 hours after starting a meal. But Dr. Bernstein discovered something crucial. These targets are not normal blood sugar levels. A healthy person without diabetes has blood sugars that rarely go above 100 milligrams, even after meals. Yet diabetics are told that 180 milligrams is acceptable. The law of small numbers. Dr. Bernstein's most important discovery is what he calls the law of small numbers. This principle states, big inputs make big mistakes. Small inputs make small mistakes. Think about it this way. If you eat 60 grams of carbohydrates and miscalculate your insulin by just 10%, that is a 6-gram error. Your blood sugar will spike or crash dramatically. But if you eat only 6 grams of carbohydrates and make the same 10% error, that is only 0.6 grams, barely noticeable to your blood sugar. Real-world application. Instead of eating a large pasta dinner and trying to match it with insulin, eat a small salad with protein. The margin for error becomes so small that achieving normal blood sugars becomes predictable and safe. Dr. Bernstein's approach rests on 3 fundamental pillars that work together to normalize blood sugar. Pillar 1. Very low carbohydrate diet. This is the foundation of everything. Dr. Bernstein recommends limiting carbohydrates to approximately 6 grams for breakfast, 12 grams for lunch, and 12 grams for dinner, a total of about 30 grams per day. Why so low? Because carbohydrates are the only macronutrient that directly raises blood sugar. Protein has minimal impact, and fat has virtually none. By severely limiting carbs, you eliminate the biggest variable in blood sugar management. Your breakfast might be eggs with cheese and spinach instead of cereal and orange juice. Your blood sugar stays stable all morning instead of spiking and crashing. Pillar 2. Frequent blood sugar testing. Bernstein pioneered blood glucose self-monitoring and the tight control of blood sugar. That is now accepted as the standard treatment of diabetes. But he takes it further than most doctors recommend. Test before meals, 1 hour after meals, at bedtime, and whenever you feel off. This is not obsession. It is data collection. You cannot manage what you do not measure. Before eating anything new, test your blood sugar. Eat the food. Test again in 1 hour. Now you know exactly how that food affects you personally. No guessing required. Pillar 3. Appropriate medication use. Dr. Bernstein advocates for using the right medications in the right amounts. For type 1 diabetics, this means using small amounts of insulin because you are eating small amounts of carbs. For type 2 diabetics, this might mean metformin or other medications that improve insulin sensitivity. The key insight: when you eat very few carbs, you need very little medication. This reduces the risk of hypoglycemia and makes blood sugar control much more predictable. The exercise protocol. Dr. Bernstein's exercise recommendations might surprise you. He advocates for brief, high-intensity resistance training rather than long cardio sessions. Why? Because extended cardio can actually raise blood sugar in diabetics due to stress hormones. His protocol: 15 to 20 minutes of weight training, 3 times per week. Focus on compound movements that work multiple muscle groups. This builds muscle, improves insulin sensitivity, and does not cause problematic blood sugar spikes. Instead of jogging for an hour and watching your blood sugar rise unpredictably, do 3 sets of squats, push-ups, and rows. Your blood sugar stays stable, and you build metabolism-boosting muscle. The shocking results: patients following Dr. Bernstein's method achieve hemoglobin A1C levels below 4.6%, which is in the normal, non-diabetic range. For context, many diabetics struggle to achieve the recommended target of 7%. And Dr. Bernstein's patients are achieving levels that most doctors would consider impossible for diabetics. But the benefits go beyond blood sugar. Patients report: elimination of dangerous blood sugar swings, dramatic weight loss without hunger, increased energy and mental clarity, reversal of diabetic complications, reduced or eliminated need for medications. One patient's story illustrates this perfectly. A type 2 diabetic with an A1C of 11% started following Dr. Bernstein's protocol. Within 6 months, his A1C was 5.2%. He had lost 40 pounds, and he was off all diabetes medications except metformin. The controversy and critics. Dr. Bernstein's approach faces significant resistance from medical establishments. Critics worry about the sustainability of such a low-carb diet and potential long-term effects. Some doctors fear that patients will not comply with such strict carbohydrate restrictions. But Dr. Bernstein has been following his own protocol for over 50 years. He is now in his 90s, has normal blood sugars, and has avoided the complications that typically accompany decades of diabetes. His results speak louder than theoretical concerns. Implementation strategy. Starting Dr. Bernstein's program requires commitment and medical supervision, especially if you take diabetes medications. Here is how to begin. Week 1. Start blood sugar testing. Test before and after every meal. Create a baseline understanding of how different foods affect you personally. Week 2. Begin reducing carbohydrates gradually. Start by eliminating obvious sources: bread, pasta, rice, potatoes, fruits, and sweets. Focus on vegetables, meat, fish, eggs, and cheese. Week 3. Fine-tune your carb intake to Dr. Bernstein's targets. Work with your doctor to adjust medications as your blood sugars improve. The mind shift required. Dr. Bernstein's approach requires thinking about diabetes differently. Instead of managing the disease, you are normalizing your blood sugar. Instead of accepting good enough control, you are aiming for the blood sugar levels of a healthy person. This is not about perfection. It is about precision. Every food choice becomes intentional. Every blood sugar reading becomes data that informs your next decision. Your takeaway challenge. Dr. Bernstein proved that normal blood sugars are achievable for diabetics, but it requires abandoning conventional wisdom and embracing a radically different approach. Here is your challenge. For the next week, test your blood sugar before and 1 hour after every meal. Track what you eat and how it affects your numbers. You will likely discover that foods you thought were diabetic-friendly are actually causing dangerous blood sugar spikes. Then ask yourself this question: if you could achieve normal blood sugars by changing what you eat, would you be willing to give up bread, pasta, and fruit? Dr. Bernstein and thousands of his followers have proven it is not only possible, but life-changing. Your diabetes does not have to control your life. With Dr. Bernstein's methods, precise measurement, and unwavering commitment to normal blood sugars, You can take control of your diabetes instead of letting it control you. The data does not lie, and neither do the results of those who follow this protocol faithfully. Your journey to better health starts here. Subscribe now for fitness tips and natural diabetes reversal guides. Take care, stay healthy, and see you in the next video.